Are you wearing gloves when you do medication rounds? When you bring patients their meals? When you are typing on the computer? When you're transferring patients, etc.? There is no need to wear gloves when doing these activities.
The Gloves Off campaign is very much about the reduction of healthcare associated infections. We know that in the Trust since 2019 we've had a third more gram-negative associated infections, and also we've seen a quarter more Clostridium difficile infections within the Trust, and this is really worrying to us as a team. One of the things that we can do is think about our critical points when dealing with our patients, thinking about the 5 moments of hand hygiene. When you clearly need to do your hand hygiene is absolutely critical that we reduce our infection rates by doing good hand washing and removing our gloves.
I'm really pleased to be supporting the Gloves Off campaign. It's a really useful reminder that while the gloves are there to help protect our staff, it's hand hygiene that really helps protect our patients from hospital-acquired infections. And having real clarity about what we should be doing when helps us achieve both as best as we possibly can.
Gloves make up the biggest proportion of single-use plastic items that we use here at CUH, with a shocking 31.6 million pairs of gloves been used and thrown away in 2023.
Not only will it help sustainability, but it will reduce the amount of gloves that we're having to wear, which can create sores on our hands. Within the estates and facilities, we have a broad range of disciplines, and within that, we need to make sure that we're doing the correct procedures.
What we found through our audits was that gloves were put on too early. They're not changed at critical moments, or they're not being removed when the patient contact is finished. This is unfortunately one of the reasons why infections are being transmitted from one patient to another. The Gloves Off campaign is not only about knowing what to do at the correct time. It's about the environment. It's about keeping patients and members of staff safe, and it's about stopping the transmissions of infection.
The Infection Prevention and Control nurses will be visiting all clinical areas in order to provide education and support surrounding the Gloves Off campaign. We will answer any questions and concerns that you might have and help you to remove hurdles where possible. Please familiarise yourself with the posters and the fob cards, which provide you with valuable information to when you should and shouldn't wear gloves. When you are in the clinical area and you go to put on a pair of gloves, just stop and think, do I really need to wear these gloves? Is there an associated risk?